The next speaker, who will present findings from a randomized phase 3 trial comparing laparoscopic surgery to open surgery in people whose colorectal cancer has metastasized to the liver. Dr. Osmund Fretland is a surgeon in the Intervention Center in the Department of, I guess that's hepatobiliary surgery at Oslo University Hospital in Norway, and he will present the study.
Ladies and gentlemen, first I would like to thank ASCO for allowing me to present these results on behalf of Professor Bjørn Edvin and Dr. Aghayan and a large group of researchers at Oslo University Hospital. Colorectal cancer is one of the top 4 cancers in the United States, with more than 160,000 new cases each year. Half these patients get liver metastases, but thanks to advances in oncologic treatment and in surgical knowledge, more and more of these patients can be operated. Open surgery has been the standard operation for liver metastases, but laparoscopic or keyhole surgery is considered a minimally invasive alternative to open surgery. However, a recent survey showed that only 22% of United States patients with colorectal liver metastases that have surgery for it have laparoscopic surgery. Our trial is the first to compare laparoscopic and open liver surgery for colorectal metastases. We designed a randomized controlled trial to find out if laparoscopic liver surgery is better for the patients than open liver surgery. The primary outcome was postoperative complications within 30 days. We included patients from 2012 to 2016, a total of 280 patients. All the patients had what we call parenchyma-sparing surgery or liver-sparing surgery, the surgical technique that removes only the tumor and leaves behind a maximum amount of healthy liver tissue. Our group had a large experience of laparoscopic liver operations before the study started, as much as 400 operations. We pre-planned a survival analysis 3 years after the last operation, and these are the data we are here to present. First, the short-term outcomes. Laparoscopic liver surgery was in general better tolerated by the patients. They had less complications, 19% versus 31% in the open group. The hospital stay was shorter, only 2 days versus 4 days in the open group, and they reported better quality of life up to 4 months after surgery. In a cost-effectiveness analysis, we couldn't find a difference in costs, and with better quality of life and similar costs, we could state that laparoscopic liver surgery was cost-effective. These data have been published in Annals of Surgery last year. These are the long-term outcomes after a median observation time of 45 months. Overall survival was the same for laparoscopic and open liver surgery. A 5-year overall survival of 57% in the open group and 56% in the laparoscopic group, no difference. The chances of disease recurrence were also the same, with a 5-year recurrence-free survival of 31% in the open group and 29% in the laparoscopic. These are the Kaplan-Meier curves. So we see that more than half of the patients that have surgery for colorectal liver metastases, colon cancer that was spread to the liver, live for more than 5 years after the liver surgery. Furthermore, we see that patients get recurrences, but the recurrences can also be removed. And a total of 55 patients have so far undergone repeated liver resections for recurrent metastases. And also 16 patients have been operated for lung metastases following the liver surgery. To conclude, ladies and gentlemen, laparoscopic liver surgery did not change the chances for survival compared to open liver surgery. Laparoscopic surgery was better for the patients at no additional cost to the society. And we hope that these results will encourage more hospitals to establish a laparoscopic liver surgery program. This has to include structured training of the surgeons. Thank you so much.
Okay, very interesting. So, Dr. Baxter, you're a surgeon. What do you think?
So thank you for allowing me to speak on this important piece of work. Liver resection for colon cancer spread to the liver can be curative for patients. And this research shows that the surgery can be done with minimally invasive techniques, small incisions, giving patients the benefits of better short-term recovery with no downside in terms of survival and cost. This is news, and this is important news. So in other areas of complex surgery, so this is a complex operation, the results haven't been as good for minimally invasive techniques, specifically pancreatic cancer and cervical cancer. So it is important news that these minimally invasive techniques can be extended to patients with needing liver resections with no downside. Now, it's important in this study that this was done in expert centers. Standard surgery is still safe and effective, but if you are able to have surgery by experts for specific types of operations that are amenable to laparoscopic surgery, this is an excellent approach. And we've now found that it is an approach that results in equal survival for patients. So that's potentially 88% of patients in the United States where there's possibility that laparoscopic techniques could be extended to them, improving their short-term recovery, allowing them to get on with life.
Great. One